Hello, my name's Tim Owen-Jones. I'm a student lead at the College of Medicine, one of the student strategy group, and I'm here in the Herb Garden in Bob's Park at the Bromley by Bow Centre to reflect a little on the Unlocking Social Prescribing seminar that I was invited to attend a few weeks ago. So the centre and the college arranged for me to go to the seminar in my role as a strategy member and as a student nurse. It was attended by approximately 30 health and social care professionals from around the country, and the day consisted of the centre and what goes on being introduced to us by different members of staff from its beginnings and key players in setting it up, to the different activities and organisations that exist within the umbrella of the centre's name. We then got to see the different areas of the centre, the GP surgery, the park, the church and nursery, the garden, the information centre and citizens' advice. We had a delicious lunch in the restaurant that's run by members of the local community, and we then finished the day coming back together and discussing probably the philosophies of the centre together before reassembling and summarising what we'd learnt and what we'd thought about throughout the day. For this video I wanted to show briefly the Bromley by Bow Centre, the centre and the restaurant, the GP centre, the advice centre, the park. I also wanted to explain briefly what social prescribing is, and I thought it perhaps better to ask somebody who works here.
My name's Sol Marmot. I'm a GP. I've been working at the Bromley by Bow Centre. I've been working here for about 16 years now. This was the first job that I saw that I really wanted, and that's what made me come and get it. And there's a lot of reasons for that. Things have changed a lot in medicine over the last few years. At medical school we learnt about prevention, and prevention was very much about when somebody's got a disease, how do you then prevent it from getting worse? There was a little bit about what we call primary prevention, which are how do you stop people from getting heart disease or diabetes? What we tended to learn was stop them smoking in the first place and make sure they eat a healthy diet, and that was it. Most of the focus of medicine tends to be around, once people are ill, what do you do? What medication do you give them? There is something about lifestyle advice. But unfortunately things have gone very much towards the treatment rather than the prevention. People talk about holistic healthcare, and people talk about holistic healthcare. It means different things to different people. So what we tend to learn about holistic is looking at the patient as a whole person. So rather than, Mrs. Smith who has the liver condition in bed C, it's more about Mrs. Smith who's got the liver condition and diabetes and possibly a bad foot in bed C. We tend to look at holistic care in a much better way, I think, when you look at Mrs. C in the context of a whole life. So why has she got diabetes in the first place? Why is it that it's gone out of control? What are the social factors that mean that she's going to find it harder to get better? And at the Bromley by Bow Centre, this is what we try and look at. So we try and look at the wider determinants of health. The way you look at the wider determinants of health, so in other words, what's her housing like, what's her family situation like, what's her education level like, is she able to go out and look for information herself to try and work out what's best to do for her, how able is she to do those things, and there's a whole variety of other social factors that lead to her ability to recover, and indeed her propensity to be getting ill in the first place. Deprivation is one of the biggest things, one of the biggest factors. So the way we try and look at it is through something called social prescribing. Social prescribing is basically a mechanism by which we as clinicians try and look at these background things that make people sicker or make it harder for them to recover. It's a mechanism that reminds us that we have to be doing this and that we have to be taking these things into account. It's thought that something like 30% of cure is about giving medications and giving lifestyle advice, and the other 70% is about trying to help people sort out their lives in the background.
I really enjoyed hearing about social prescribing, and I was impressed by how many organisations share a goal and work together to come on together as the umbrella, or under the umbrella, of the Bromley by Bow Centre, and how they are developing a new model of how health and social care exist. I was really inspired by how the organisation really is quite cutting edge in trying to move away from just a clinical solution, just a medical solution and the medical model, and how that started from next to nothing and how it's gone from strength to strength. I was also really impressed to hear how I think every member of staff was able to give an example of how they put patients and patient situations at the very centre of what they do. I like how patients are the boss and how people really work together on this. In my studies, we're taught about the huge importance of person-centred care, and this can feel it's sometimes difficult to achieve when so many clinical and bureaucratic tasks can get in the way. We're also taught more and more about medical models and clinical and medical solutions are just part of a bigger picture. In the new government's 5-year plan, agreed on by most political parties, it's recognised that the reliance on medicines with their huge costs needs to change, and more evidence suggests that in many cases they've been inappropriately used anyway. Just look at antimicrobial resistance, for example, which is just one modern and quite serious problem. Also, patients have ongoing long-term conditions and comorbidities that might be better managed with non-clinical interventions, and that may even be preventable, and how we as healthcare professionals can recognise that and make time to include these when we're making plans with patients. The day, I think, helped me see that there are ways to ensure that patients remain at the centre of what we do. As a nursing student, it can seem daunting sometimes to try to plan how I'll fit within the health service once I qualify. Working as a nurse can seem daunting when I think about how big the NHS is and how busy I'll be, how it needs to be so highly structured, and how hierarchical it is. And when I think about how it all fits together, you get the feeling that sometimes patients aren't at the top of the ladder or aren't at the front of your mind. And you, at the very least, as a healthcare professional, want to spend as much time as possible with patients, which is why you originally wanted to go into healthcare. The centre showed me that well-being is complex for patients and for staff, and the context of a situation, I think, is everything. The bigger picture is really everything, and the centre's been able to address that, albeit through everyone involved. It's really, really hard work. So to conclude, and what I want to take forward would be to work hard to ensure I listen hard and make time to listen hard to patients when assisting them with managing their health. The centre incorporates many different professional people to address the situations that patients present to them. And I think when I qualify, I'd like to work in a similar manner, to perhaps really work hard to find the source of a problem and help patients find a solution. That might involve their health, but also a socially determined problem that I might be able to include in a plan or make a referral for someone else to be able to help. To end my reflective video, I thought it would be nice to hear what Dr. Marmot likes about his job, and maybe that could give an idea of how social prescribing and an environment like this has enabled him to work as a health professional.
So what attracted me to working here in the first place was the fact that people are seen as people, but they're also seen as part of a family and part of a community. For me as a GP, the thing that I love about working here is, first of all, I work with a huge variety of people who are not healthcare professionals, who inevitably see things in a different way and see things sometimes with a less cold heart, I have to say. See things from a more human perspective, especially as some of the people I work with are also patients. In fact, most of the people I work with are patients in themselves, but they're local residents, and they may be patients here or elsewhere, but they have that experience of the patient journey. I suppose my vision for the future, it may be ideological, but I think that because we know that so much of health is to do with people's social background and the wider determinants of health, I would say that the only way we're going to have healthier communities is by having social prescribing available to more doctors, more nurses across the country.